In today's video, you'll learn how infections like Lyme disease, Bartonella, and environmental triggers like mold can contribute to PANS, why some children experience severe neurological symptoms after infections, and why identifying these underlying drivers is so important. Welcome to my YouTube channel. I am Dr. Jaquel Patterson, nationally recognized naturopathic physician, functional medicine doctor. In this video, we're going to cover 3 critical points: how infections can trigger PANS and neuroinflammation, the connection between mold exposure, tick-borne disease, and immune dysregulation, and integrative medicine strategies used to support recovery and calm neuroinflammation. So PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome, and one of its defining characteristics is sudden onset of symptoms. Parents often describe a child who seemed to be doing well and then almost overnight develop symptoms such as OCD, anxiety, or panic, tics, irritability or emotional dysregulation, sleep disturbance, food restriction, sensory sensitivities, cognitive regression. And one of the key mechanisms behind PANS is immune activation in response to infection. Certain infections can trigger an inflammatory immune response that affects the brain, particularly areas in behavior, mood, and executive function. And the infections usually connected are strep, which is classically associated with PANDAS, Lyme disease and Bartonella, Mycoplasma pneumoniae, Epstein-Barr virus, viral infections such as influenza or COVID. And when the immune system responds to infection, it provides inflammatory molecules like cytokines. And in some individuals, this immune response can actually affect what's called the basal ganglia. It's a brain region involved in movement regulation, behavior, and emotional processing. And it's why children with PANS or PANDAS may develop symptoms like OCD, motor tics, intrusive thoughts, mood swings, impulsivity, and in many cases, these symptoms are not purely psychological, they're neuroimmune symptoms driven by inflammation. So when infections are contributing to PANS or PANDAS symptoms, the goal is not only to just address the infection, but also to reduce inflammation and support immune regulation. This may involve things like targeted antimicrobial treatment when appropriate, immune modulating therapies, addressing underlying triggers that perpetuate inflammation, and we also do things like low-dose immunotherapy. We may look at herbs such as things like Japanese knotweed, known for Lyme disease and its antimicrobial properties, cat's claw for immune system balance, andrographis, which helps with immunosupportive benefits as well as antimicrobial. And these strategies are always, we want to make sure, individualized though, based on the patient's presentation. Now, another critical factor in many PANS and PANDAS cases is actually environmental exposure, particularly mold toxins and mycotoxins. So that could be from water-damaged homes, buildings, schools, and mold can produce, again, those mycotoxins, which affect several systems in the body. And they can disrupt immune regulation, which makes infections even more difficult then as a result to control. And second, mold toxins can trigger neuroinflammation, which triggers symptoms like anxiety, cognition, mood, temperamentality, and also affects the blood-brain barrier, which allows inflammatory molecules to reach the brain tissue more easily. And it's one of the reasons some children with PANS experience symptoms such as severe brain fog, mood swings, light sensitivity, fatigue, sensory overload. And when mold exposure occurs alongside other infections like Bartonella, symptoms can become more complex. Lyme disease, for example, itself can affect the nervous system. The bacteria associated with co-infections can trigger neuroinflammation, autonomic nervous system dysfunction, immune dysregulation. Other common Lyme infections are Babesia, Anaplasma, and Bartonella, as I mentioned. And these infections can produce symptoms that are neurological in nature. They can cause things like anxiety or mood changes, fatigue. They can affect the sleep, and it can also affect sensory sensitivities. And when mold exposure and plus infections, they occur together, the immune system may remain in this chronic inflammatory state, which then can sustain these PANS symptoms. So naturopathic medicine strategies when mold exposure, for example, is suspected, the first step is to identify and reduce the exposure source. That can include environmental testing, remediation of water damaged environments, improving indoor air quality, and once exposure is addressed, detoxification strategies can include things like liposodium glutathione to support antioxidant defenses and support the liver, binders such as activated charcoal or cholecystiramine, phosphatidylcholine, sauna therapy, and detoxification protocols just must be approached carefully because children with PANS may be particularly sensitive. So PANS involves immune and neurological inflammation. So So treatment will often focus on calming the immune response while also supporting the brain. So several areas are particularly important. Reducing neuroinflammation, chronic immune activation can actually lead to inflammation in the nervous system, and strategies can include things like curcumin, which has anti-inflammatory benefits, NAC to support glutathione production, omega-3 fatty acids, SPMs, which help to regulate these inflammatory pathways, and these nutrients also to help support brain health and reduce inflammatory signaling. You also want to support the gut and immune health because the gut microbiome plays a major role in immune regulation, and children with PANS have gut dysbiosis or intestinal inflammation, which can worsen immune imbalance. So you want to look at targeted probiotics, symbiotics, prebiotics, and anti-inflammatory nutrition to restore the gut health to help regulate immune responses. Also, you want to look at nervous system regulation because PANS affects both the immune system and nervous system. Supporting balance is really important. So this can include improving sleep hygiene, reducing inflammatory foods, supporting mitochondrial health, stress regulation therapies, going or seeing a behavioral therapist. When nervous system becomes less reactive, children will experience improvements in behavior, mood, and cognition. So PANS, as you can see, is a complex condition, and in many cases, the symptoms are driven by a combination of infection, immune dysregulation, and environmental triggers. And when we identify these underlying factors, whether it's Lyme disease, Bartonella, mold exposure, chronic infections, or inflammatory triggers, we can then create a more comprehensive treatment plan. And when these root causes are addressed, many families begin to see meaningful improvements in symptoms like OCD, anxiety, brain fog, sleep issues, emotional regulation. And it's why naturopathic medicine focuses on understanding this whole picture rather than looking at symptoms in isolation. If you like this video, you'll probably like the one on the root causes of brain fog and neuroinflammation, so please check it out here on my channel. If you found this as helpful or could help somebody else that you know, please subscribe and hit the notification bell because I'll be sharing more videos on integrative psychiatry, PANS and PANDAS, chronic illness, and root cause medicine.